We're going to take a break right now because I'm going to bring on the person that you really came to hear talk about healthcare reform, Mr. Herman Cain.
Well, good afternoon. I apologize for my tardiness, but I just got off in an airplane from Arkansas. And no, I was not out there where they had that flood, that flash flood. That was 2 hours west of Little Rock. And I was there for a Defending of the American Dream conference, so I do apologize for the tardiness. My chief of staff made one small miscalculation. When you're flying west to east, it's called an hour you add. Other than that, he was just fine. He forgot to add back the hour that we gained going out. So I do apologize, and sorry that I missed these doctors' comments when they were opening up. And but I wanted to be here because, first of all, healthcare is critical and important to everybody. Men's wellness and the awareness of it is probably doesn't receive the amount of attention, and so with this conference kicking off, it kicks off Men's Health and Wellness Week. I wanted to be here to answer some questions along with these gentlemen about it and give my perspective. And for those of you that listen to the Herman Cain Show, I think you already know how I feel about it. And I'll just make a couple of opening comments, and then we'll throw it back open to questions. The first is, there's probably, healthcare legislation has 2,700 pages. I could give you 2,700 reasons as to why it should be repealed. But I'm only going to give you one. And that is, it broadens the powers of the IRS to be the health care police. And that's exactly what's in there. I didn't read the whole 2,700 pages. I read that section, and it was frightening. And I started talking about it because a lot of people don't realize you're going to take the Internal Revenue Service, a bureaucracy that we already need to do something about, and they are going to check whether or not you have insurance. Do you have too much? Not if you have enough. You will be penalized if you have too much. That's kind of upside down thinking to me, because of what they call this Cadillac cap. And then you'll be required to provide proof that you have health insurance the way the government wants you to have it. And as if these fine gentlemen in their profession don't already have enough problems to deal with, they're going to be all over the doctors. They're going to be all over the hospitals with more regulations, more constraints. And my second point that I want, so the idea of the IRS being the healthcare police in this country, to me, is a frightening, frightening thought. Most people don't realize all of the other, what I call grenades, buried in that legislation, because we're just now learning as we go about all of the grades. But the biggest one to me that I just absolutely have a problem with is this whole thing about the IRS now is going to be the one that's basically going to be the healthcare police. And let me tell you some more good news relative to that little nugget. They're going to hire 16,000 more IRS agents to enforce it. Who pays for the IRS agents? We do. This is ridiculous. And the third point, then I'll move on to my fourth point. It's hard to talk about this crazy legislation with just a couple of points. It's ridiculous. And then, so you got the IRS is going to be the healthcare police. They're going to hire 16,000 more agents to help enforce it. You know, that itself is bad enough. And my other point is, this will lead to healthcare rationing. They're in denial, they don't want to tell you that, but it will lead to healthcare rationing. Canada is trying to find out how to unravel their system. You don't hear about those stories. Germany is trying to unravel its socialized system. You don't hear those stories. I'm sure these doctors hear about some of them. And you also have England trying to figure out, well, what is it going to do? Because anytime you give something to the public and they think it's free, they're going to use too much of it. It's just that simple. Now, there is a better way to do this. Many people are not aware that when H.R. 3200 was introduced, that the Republicans on July 30th, 2009, Representative Tom Price from Georgia was the chief sponsor of H.R. 3400, which was a set of market-driven reforms. When he introduced it, he at least got the opportunity to introduce it, and it immediately was relegated to committee. 13 committees. And I asked Representative Price, how does it get out of committee? When Nancy Pelosi says so. That's over a year ago. Most people don't even know that there's a better proposal. Now, if you want to know what's in H.R. 3400 without reading the entire legislation, I wrote a commentary outlining the 10 things that it would do to help bring down healthcare costs and help increase accessibility. And the points that they recommended in that legislation, they don't punish doctors, they don't punish providers, they don't mandate anything, and it is the way that, quite frankly, the Republicans have been trying to move in that direction for quite some time. And so, H.R. 3200, which is, well, it's not H.R. 3200 now, it's a Senate bill that they forced through the House so they could get a signature so they could declare victory. But it is absolutely, in my opinion, the wrong direction to go. Can we repeal it? I believe so. But only if there's a change of control of Congress in November. If there's no change of control of Congress in November, it will never be repealed. And we will have socialized medicine heading down that track. And we will destroy the best healthcare system in the world, in my humble opinion. I wish I had a better opening for y'all to make you feel better, but I got to tell you the truth. So with that, we are ready to take questions.
And we were talking about how we were depressed earlier today about this healthcare bill too. So sorry if you brought it up, but we've been there with
It's not happy news.
Yeah, some knowledge is not so happy.
Yep. The question is, how will the IRS determine if you have too much insurance? In the bill, there's going to be a healthcare oversight commission. That may not be the technical term, but the Healthcare Oversight Commission, which will be appointed by the president, will determine for a family of 4, a single person, how much insurance you should be allowed to carry. The last number that they kicked around was for a family of 4, you should be able to spend, it might be $16,000. Don't hold me to these numbers. This is just an example.
I think it's 23.
$23,000.
It's over 20.
$23,000 for a family of
27.
And by 2018.
Okay, by 2018. So what they're saying is, if you buy a health insurance package that costs $28,000, you've bought too much. You don't deserve to buy more simply because you can afford to buy more. So if you buy more than $23,000 worth, you will be taxed on the amount above the government-approved level to penalize you for being able to buy more than what the government thinks you should have.
All right, that's $23,000 a year in your example, or 28. Is that for medical, vision, dental?
Yes. Healthcare package.
A whole package.
Okay, and that's the premium per year.
Yes.
The further problem with that is that the premium from that point forward, from 2018, is not adjusted to healthcare inflation. Healthcare inflation is going up more quickly than our inflation, for our consumer price index. So that means that if they have not adjusted that to healthcare inflation, more and more people, as their healthcare costs are going to go up, are going to start getting hit by that taxation. So 28,000 in 2018 is not going to be 28,000 in 2019. So if you're still paying 28,000 now, you're going to that window is going to get more and more narrow. More and more people are going to dump into that excess cost.